Good afternoon. Hello, my name is Jeong, and I'm a rising junior in an LCS JHU, a British international school located on an island in South Korea. As a brief introduction to myself, I'm passionate in biochemistry, especially cell biology and material science, and was involved in a job shadowing experience at an immunology lab, and is currently working through an internship program at an IPSC-specific company. Moreover, I'm a member of a school service group called Towerade, where I've organized various fundraising events such as Support Turkey at Earthquake, Summer Fete, and Christmas Bazaar, donating over $10,000. Today, I'll be presenting about achieving health equity for people with disabilities. An employee is refused their flexible working request just because they're not Christian. A dentist denies a teenage girl a service because of her behavior related to a disability. A workplace adopts a rule of not hiring workers who are too old. All of these real-life discrimination arise from a false dichotomy that can be presented in a situation to be seemingly adversary when it could be cooperative. Speaking in a more scholarly way, this phenomenon is known as the us versus them effect. This natural human tendency allows us to oversimplify a complex problem in the world by supporting the us and vilifying the them. A famous quote from Robert Sapolsky, an American endocrinologist, states that we turn the world into us's and them's, and we don't like the them's very much and are often really awful to them. This problem not only exists as a political us versus them division, nor discrimination against immigrants, biracial, or bicultural individuals, but also to people with disabilities who are often marginalized in society. According to WHO, an estimated 1.3 billion people globally are experiencing a significant disability today. This is equivalent to 16% of global population, meaning that of 20 people you encounter each day, 3 of them are experiencing significant disability. Despite such a large number, what are our efforts to support them, or are we even noticing them? In such a diverse community, these people share disabilities that comes in various forms at different stages of life. Some people are born with disabling conditions while others demonstrate or acquire disabilities through injury or chronic conditions. Although several actions are said to be initiated towards the subject of disability, progress in meeting the needs of disabled has been slow. People with disabilities demand the same attention and must not be lightly dismissed due to our stigmas. Primarily, the most important question we have to address is, what exactly is health equity? This subject is the main component for many health organizations around the world. Specifically, WHO clarifies that health is a fundamental human right, and is achieved when everyone can attain their full potential for health and well-being. This includes health promotion to prevention, treatment, rehabilitation across the life course regarding financial hardships. But currently, are people with disabilities receiving appropriate health services? Surprisingly, adults with disabilities are 4 times more likely to report their health to be fair or poor than people with no disabilities, according to National Center for Health Statistics. And Center for Disease Control and Prevention stated that people with disabilities compared to those without have less access to healthcare with increased chance of depression and anxiety, which ultimately leads to risky health behaviors such as smoking and overly sedentary, inactive lifestyle. So, based on Disability Inclusive Health Service Toolkit by World Health Organization, I've identified different barriers that disabled people face when accessing healthcare services at various stages. Stage 1. Awareness of services. Are people living in remote areas aware of possible health services they could receive? Stage 2 and 4. Leaving the house. Do people with disabilities need help leaving the house? What transport will they take, a public bus or an Uber? Stage 3. Finance. Is health services as well as medications affordable to them? Stage 5 and 6. Is the center clearly signed and waiting rooms including toilets accessible for all? Stage 7. How will the specialist communicate with those in need of help? Are all diagnostic equipments present? And lastly, Stage 8. What will occur after the appointment? Acknowledging these barriers, there has been successful attempts to target disability inclusion. Firstly, financing to ensure that everyone benefits equally from public healthcare programs. According to WHO report, for every $1 invested in disability inclusive cancer program could return up to $9. Secondly, constant and up-to-date monitoring research. Projects such as EHDI across the United States actively tracks children at risk for permanent hearing loss, tripling the early identified cases. Last but not least, facilitating easier access to healthcare services. This can include addition of qualified sign language interpreter, use of telecommunication, and doors with lever handles, wheelchairs, accessible bathroom, and more. Now, all the awareness and solution comes the effort. How did I, as an international student with passion for health, contribute to achieving health equity for people with disabilities? Last Thursday, my service crew made our 11th visit to 평화의 말, or directly translated to Peace Village, a local workplace and a community center for the disabled. It is located in Jeong, a small town in JHU, the far south island of Korea. As usual, we prepared two varying activities to spend time with the workers at Peace Village. This time was 딱지치기, a traditional Korean game, and an origami. The players at the Peace Village gather around at a table and begin folding either the 딱지 or the origami based on their preference. This is just a small selection of what we've accomplished, as you can see on the photo. Previously, our service group prepared other activities such as bracelet making, flower growing, and soccer. Then, what are the benefits of these disabilities recreation? Obvious, yes, certain physiological benefits such as increased cardiovascular injuries are listed on the slide shown, as well as psychological benefits like fluent communication and teamwork with boosted confidence. All these benefits are important because they eventually lead to greater independence, giving the ability to complete daily tasks without assistance. I hope that helping them pursue an environment in which social integration is achieved through self-reliance, we can ultimately improve the quality of life for people with disabilities. In the future, I am planning to expand such services and hold larger athletics events with other disability centers around JHU. Incorporating scientific elements and designing cool experience could be another great activity to enjoy. To sum up, what I define as health equity is inclusion. Every day we engage with other individuals, learning through sharing. I understand that it's never difficult to arouse one's sympathy for disabled people, but in Global Health Leaders Conference 2023, rather than shedding light on only individuals' health, we as global citizens and future health leaders must act with inclusion to protect the fundamental human rights, the access to healthcare, stepping forward to achieving health equity for people with disabilities. Thank you.